So today I'm going to be doing an insulin injection. So the first thing you want to do is verify your doctor's orders for the type of insulin, the amount and the frequency, and then what type of insulin protocol you're using. For example, the sliding scale. And then you want to discuss this with your patient, explain to them what the sliding scale is and the difference between the regular insulin and a long-acting, so they understand what they're getting and then how the insulin works in the body. And now you're going to wash your hands and actually prepare to drop your medicine and give it. So you always want to draw up insulin with another nurse so that they're checking to make sure you don't make any mistakes. So first you're going to get your insulin. So I have NPH and regular insulin, and you want to check the expiration date and make sure you have exactly what you need off of what the order says. And you always want to check to make sure you have the right medicine when you're taking it out of the cabinet, when you're preparing it in at the patient's bedside, or before you put it away, before you give it, to make sure you have the right one. So you need an insulin syringe, and this is the insulin syringe I'm going to use. It's done in units, and in general it has an orange cap. So now we're going to begin. So I've already washed my hands, and the first thing I'm going to do is use an alcohol swab and clean the top of both insulins. And now you're going to inject air. So I'm going to be putting 2 units. I'm going to be drawing up 2 units of each. So first you want to start by injecting air to equalize the pressure. So I'm going to put 2 units of air into the cloudy insulin, which is the NPH. And then I'm going to inject it, and be sure not to let the needle touch any of the insulin inside, because you don't want to contaminate the two with each other. And now I'm going to put 2 units of air into the clear. And now, with another nurse watching to make sure we're doing this correctly, I'm going to draw up 2 units of the clear insulin, which is regular. And the nurse is going to check it while the needle and everything is still in here. So there's 2 units. And now I'm going to draw 2 units out of the NPH, which would be the cloudy insulin. In this part, you don't want to inject anything back into it because you're going to be putting regular insulin. And again, you're going to have another nurse check it while the needle's still in the bottle. So there's 4 units total. And again, I will also check this with another nurse. So now I'm going to take this to the bedside of my patient, and I'm going to administer it, which is just a sub-Q injection. And so I'm going to wear gloves, perform hand hygiene, wear gloves for this. It's a sub-Q injection, so you can give that in the back of the arm, the abdomen, the outer thigh, wherever else the love handle where you can give. So I'm going to cleanse the area. I'm going to give the insulin. I'm going to squeeze the fat area wherever I'm doing it, and then give it at a 45-degree angle, and then put this in the sharps container. And then I want to monitor my patient for hypoglycemia. So the signs and symptoms are they start to not feel very good, and diabetic patients know, and they'll tell you when they're having it, but they start to feel fatigued and maybe some vision issues, and they just genuinely don't feel good. And you want to document all of the insulin, and the other nurse that checked it with you also needs to document what she did. And then lastly, if your patient is having low blood sugar, the antidote for insulin is glucagon. So that's all.